guys see, I'm a family nurse practitioner, and I am on the data work group.
I'm Sherry Gilliland. I'm a pediatrician here at Baraga, the hospital, and also at the KBIC clinic. And I also work with the data group.
I'm Cindy Parker. I'm on the board of the Baraga County Shelter Home, and I'm the chairman of the data work group.
And Jamie.
Jamie helps us also on the data work group.
So, Communities That Care began as an offshoot of the Baraga County Substance Abuse Coalition because of concerns about drug abuse in the community. The state of Michigan provided grant funds due to the high rates of substance abuse and other problem behaviors in Baraga County young adults and youth. The Communities That Care is a prevention program, which is why we're focused on youth.
So the Communities That Care program is a proven community change process. It's worked in small communities all over the United States and other countries that are just like ours. It originated in the University of Washington State as a way to deal with community problems. The program is specific to the community and involves the community in the choices of how the work is done. So the community gets to select solutions that are demonstrated effective for similar communities. It targets teen pregnancy, violence, delinquency, school dropout, substance abuse, and depression, suicide. Those are the behaviors it looks at. It requires broad community involvement, and it only works with broad community involvement. People from the youth, local businesses, parents, the schools, healthcare professionals, the Indian community, Copper Country Mental Health, local judges and law enforcement, everybody needs to be involved to make the process work. So please consider joining us. We need all the help that we can from every community member in order to make a difference in the lives of the kids in our community. It is a prevention model, and it's based on the science of prevention. And it's based on our needs specific for Baraga County. Our data that we're going to present to you tonight is generated from our Baraga County students in all the Baraga County schools. The community chooses the priorities, and they're ones they're looking at reducing risk factors that are factors that might lead to behaviors, and also enhancing pro-social factors or protective factors that aid in preventing problem behaviors. It uses programs shown to be effective in communities like ours. The youth survey domains of the survey it took are community, family, schools, and peer and individual. The Communities That Care's goal is to build the resilience of youth by providing opportunities for them, enhancing skills, recognition of positive, behaviors, just the positives that the kids do. The mission of the Communities That Care of Baraga County is to create safe, healthy, desirable, supportive, and diverse communities that provides the protective factors which support our youth, families, community members, and local organizations. We'll pursue and achieve this mission by building a strong family foundation, connecting families to schools, encouraging healthy beliefs and clear standards for acceptable behavior, and supporting collaboration among our community resources. The Baraga County data. There was a 2004 Communities That Care Youth Survey that was taken. It surveyed all 2014. It surveyed all 6th, 8th, 10th, and 12th grade students in L'Anse and Baraga schools. It looked at their involvement in problem behaviors, risk factors that predict those behaviors, and protective factors that can buffer the behaviors. The data work group also looked at additional data from the U.S. Census Bureau, Baraga County Clerk's Office, the Youth Asset Survey, Michigan Youth Behavioral Risk Surveys, Vital Statistics, the Economic Development Plan from Baraga County, and Kids Count.
These are all of the risk factors and the protective factors that we were looking at when we we were tasked with taking this list, which is going to be 3 slides long, and bringing it down to 6, the risk factors that were the highest and the protective factors that were the lowest. So we will end up with 6 factors, but these are the factors that we assessed. In the community domain or realm, we looked at laws and norms favoring drug use, perceived availability of drugs, perceived availability of handguns. In the family realm, poor family management, family conflict, family history of antisocial behavior, parent attitudes that favor antisocial behavior, parent attitudes that favor drug use. In the school realm, we looked at academic failure, low commitment to school, and rebelliousness. In the peer and the individual realm, we looked at early initiation of antisocial behavior, attitudes that favor antisocial behavior, attitudes that favor drug use, the perceived risk of drug use, with a low perceived risk being the risk factor, interaction with antisocial peers, friends' use of drugs, rewards for antisocial behavior, intentions to use drugs, depressive symptoms, and gang involvement. The protective factors that we were looking at, in all the domains, we were looking at the opportunity and the rewards for pro-social involvement, basically the opposite of antisocial involvement. In the peer and individual domain, we also looked at religiosity, social skills, belief in moral order, and the interaction with pro-social peers.
So, on to the data. With our data, we selected the 6 risk factors, 6 factors total. 4 risk factors. They include the perceived availability of drugs, community disorganization, low perceived risk of drug use, low commitment to school, and we selected the 2 lowest protective factors, which were pro-social involvement and interaction with pro-social peers.
When we're talking about higher risk factors and lower, we're comparing to state and U.S. Norms. So these are things that were higher than across the nation, across the state.
So we're seeking the community's input, and that's why we have the vote on the 26th, to determine which of these risk factors or protective factors to focus on first for the coalition. So the first risk factor that was very high compared to national norms were perceived availability of drugs. The questions asked for this were, if you wanted to get some cigarettes, how easy would it be for you to get some? If you wanted to get some beer, wine, hard liquor, how easy would it be for you to get some? If you wanted to get some marijuana, how easy would it be for you to get some? And if you wanted to get a drug like cocaine, LSD, or amphetamines, how easy would it be for you to get some? With the answers ranging from hard to very easy. The graphs are showing you the Baraga County results. And the Baraga County results are in red in this slide. The BH norms is a national norm. It's not Baraga High School. It's a national norm.
And what our data showed was that 54% of our students felt that it would be easy or very easy to obtain marijuana. 37% felt that it would be easy or very easy to get beer. 68% thought that it would be easy or very easy to get cigarettes. And while it wasn't a part of this particular risk indicator, 45% of students answered saying they knew at least one adult who uses drugs or marijuana.
The community disorganization looked at questions like, I feel safe in my neighborhood. How much do each of the following statements describe your neighborhood? Crime and or drug selling, fights, lots of empty or abandoned buildings, lots of graffiti. And the answers ranged from, no, they don't describe my community at all, to yes, they really do describe my community, with sort of yes and sort of no being in there.
The questions that primarily contributed to this risk factor concerned crime and drug selling and fighting. 80% of students reported feeling safe or sort of safe in their neighborhoods. but roughly 32% reported fighting in their neighborhood, and 38% reported crime and or drug selling in their neighborhood.
In this slide, the blue is our results, and the BH norms are in red. As you can see, 10th graders, 60% of them, this was a high, community disorganization was a high factor for them. The next risk factor we looked at was perceived risk of drug use. This was also high, and that is whether or not the kids feel that drug use is risky. Okay? So the questions were asked were, how much do you think people risk harming themselves physically and in other ways if they smoke 1 or more packs of cigarettes per day, try marijuana once or twice, smoke marijuana regularly once or twice a week, take 1 or 2 drinks of an alcoholic beverage nearly every day, and there was also a question about, drinking 5 or more alcoholic beverages at a time. And again, the answers range from no risk to great risk.
In general, most Baraga County students think there's little or no risk in using alcohol or marijuana. 61% of the students believe there's little or no risk of harm if they use marijuana once or twice. 38% think there's little risk if they use it once or twice a week. 1 or 2 drinks a day is considered not risky by 47% of the students. 35% believe there's little or no risk if they drink 5 or more drinks once or twice a week. And while it was not part of this indicator, most students believe they will not be caught by the police if they use substances. The drugs of choice in Baraga County appear to be chewing tobacco, alcohol, and marijuana.
Low commitment to school is the last risk factor that we chose as the top 4 risk factors that were high. And the questions asked for this were, during the last 4 weeks, how many whole days of school have you missed because you skipped or cut? From none to 11 or more. How often do you feel that the schoolwork you are assigned is meaningful or important, ranging from never to almost always? How interesting are most of your courses to you, from very interesting and stimulating to very boring? How important do you think the things you are learning in school are going to be for your later life? Range from very important to not at all important. And thinking back of the past year in school, how often did you enjoy being in school, hate being in school, try to do your best work in school? And again, comparing to the national norms,
40 to 50% of the students in Baraga County endorsed hating school often or almost always. Only 32% like school often or almost always. And one of the things I thought was interesting when looking at the data, while 37% of 6th graders think that what they're learning is important for later life, only 1.6% of 12th graders think this. And in the 4 weeks prior to the survey, 34% of students endorsed skipping school at least 1 day.
So our first protective factor that was low that we chose to look at was pro-social involvement. And questions asked related to this topic is, how many times in the past year have you participated in clubs, organizations, or activities at school, done extra work on your own for school, volunteered to do community service, from never to 40 or more times?
Baraga County youth report a significantly lower percentage of involvement in grades 8 and 10 than in the other 2, but all report lower participation than the norm. 60% of students had never participated in a community project. Only about 28% regularly participated in clubs, organizations, or school activities.
And our last pro-social protective factor is interaction with pro-social peers. And the questions asked for this one is, in the past year, how many of your best friends have participated in clubs, organizations, or activities at school, made a commitment to stay drug-free, liked school, regularly attended religious services, tried to do well in school, from none of my friends to 4 of my friends?
Baraga County youth reported a significantly lower interaction with pro-social peers than the norm. Most students report that their friends try to do well in school. about 57% report that none or only one friend attends religious services, and 46% report that none or only one friend likes school.
So Baraga County does have some strengths that were on the survey. Baraga County youth are motivated to follow society's expectations and standards. Data revealed a high belief in a moral order, low levels of rebelliousness, low gang involvement, higher graduation rates than the statewide average, and low numbers of kids changing schools and moving frequently. Do we have any other questions about the data before we move on? Because we brought it with us, and we will gladly look things up if you have specific questions. So the next step will be to select the priority areas and narrow it down to 2 or 3 priorities. That is going to be based on community vote. So the risk factors that we're going to look at are perceived availability of drugs, community disorganization, low perceived risk of drug use, low commitment to school. The protective factors we're going to look at in pro-social involvement and interactions with pro-social peers. Those are the 6 factors that are going to be voted on to narrow it down to 2 on March 26th at 6 p.m. And then we're going to ask everybody to join us for trainings in April and May to begin selecting the interventions that will address the selected priorities, because that's the next step after that. We choose our priorities, and then we look at what resources are already out there in the community to address them, and what other resources we can put in place in the community that will help address our top priorities.
And looking at programs that have been evidence-based, have had evidence-based to work in communities like ours.
If you have any questions or you want to connect to CTC, our coordinator is Terry. She's right over there. And her phone number is 524-3300, extension 660, or her email is tderoccher@hotmail.com. The Communities That Care Board chairs are Kim Hendrickson, the social worker here at the hospital, so she can be reached by calling the hospital number, or Sherry Larson, she's the co-chair, and she is also here at the hospital and can be reached at the hospital phone number.